Crissman. I live in, work, and organize in Houston, Texas. I am the co-chair of the Prisoner Solidarity Committee of Workers' World Party, and welcome. We're going to be presenting a slideshow, which if you go to tinyurl.com/PSC helpful links, you can find a link to the slideshow, as well as to some other resources. The slideshow itself, you're welcome to go through as we go through together. The slideshow has many embedded links to further reports and resources that you're welcome to take a look at if you're interested. Thank you for joining us. We'll go ahead and begin by talking about what the Prisoner Solidarity Committee is. Reading from this slightly edited statement, which first appeared September 17th, 1971 in Workers' World newspaper as part of a special 8-page Prisoner Solidarity Committee insert, a report from inside Attica, in tribute to the Attica prison uprising that occurred September 9th through 13th. This justified rebellion resulted in the massacre of over 40 prisoners by the stormtroopers made up of the National Guard and state police of billionaire New York Governor Nelson Rockefeller. Some of the terms have been updated since its publishing. Once in a very great while, a rich man goes to prison. Maybe he's taking a 6-month route for a company that defrauded the people out of millions. When he gets out of his brief stretch, he's set for life. And even while he's in, every little comfort is provided for him so that the time passes as pleasantly as possible. Most of all, he is never really isolated, never forgotten. His lawyers visit him constantly. The guards treat him like a gentleman, and he is able to conduct his business affairs from prison. Prisons weren't made for people like this. The fact that a handful of them may be in a few federal institutions is largely an accident. But the prisons are full, overflowing, exploding with poor, oppressed men, women, and gender-oppressed people for whom prisons have meant the end of life, of happiness, of friends and family. The first stretch becomes a stigma that dooms a young person to life behind bars. The prisoner never sees a lawyer, is prevented from defending himself, herself, and themselves, is estranged from their family just out of sheer impossibility of visits to isolated prisons, and can look forward to desperation and disappointment when and if they ever hit the streets again. For thousands of prisoners, especially the large percentage of Black, Brown, Indigenous, and other oppressed people routed into the prisons from birth, these conditions have become unbearable. The terrible isolation imposed by the racist authorities has been broken again and again in the only way left to human beings who have been literally sealed in their own tombs by open rebellion. These rebellions are specifically directed at the numberless injustices that read like a description of the Chamber of Horrors, but they are also something more. The Prisoner Solidarity Committee is another absolutely indispensable product of this new spirit. It was formed less than a year ago in 1970 when prisoners at Auburn, New York wrote to organizations on the outside for help. Youth Against War and Fascism responded and soon helped form the Prisoner Solidarity Committee. The committee has expanded to cities since then and includes relatives of prisoners and released prisoners themselves. When news of the PSC reached the jails, it released a dammed-up flood of letters from brothers, sisters, and siblings telling of the indignities, the brutality, the pain that is a daily part of prison life. But these letters also told something else. They were not pathetic appeals from beaten people. They rang with hope and strength and willingness to struggle. Moreover, the writers themselves were thrilled that they were finally breaking out of their isolation, that people outside were listening and working with them. The PSC published some of these letters in the pamphlet Prisoners Call Out for Reading. The PSC raised money with this pamphlet and social affairs and rented a bus that prisoners' relatives could get to Auburn and visit them. For many of them, it was the first visit they had in years. When the Auburn Six had several court hearings, the PSC got sizable demonstrations of support, even in blizzard conditions. More and more, the PSC became a vehicle whereby the prisoners themselves could speak to the people outside, could generalize their struggle, use their grievances and their hopes in the mean current of rebellion that is rising in the country as a whole. Thus, it was small wonder that when the heroic Attica prisoners met with a small group of observers during the rebellion, it was the PSC delegate, Tom Soto, who they most wanted to see. It was to him that they entrusted the greatest number of messages for their loved ones, for the movement as a whole. The PSC, on hearing of the rebellion, immediately mobilized all its strength. It sent a delegation to Attica, arranged transportation for relatives, and organized many demonstrations throughout New York State and in several major cities elsewhere. The prisoners knew that what they had to say would be heard on the outside. At the most difficult moment, when ruling class fury against the prisoners reached its height, the PSC announced from inside Attica that it unconditionally supported the prisoners' demands, many of which had to do with healthcare and basic human conditions. A further bond of love and trust was forged in those tense hours. The isolation of the prisoners has been permanently shattered. Even the highest concrete wall, the darkest cell, the cruelest solitary wall can no longer hold the terror it once had, for the 1,500 men at Attica have put the worst in the midst. And this excerpt came from Workers' World newspaper. There's a link to it further. This is a story, a bit of a story about how the PSC was born, and we continue this work into the present. Now I'm going to tell you a bit about somebody who was formerly imprisoned named Bradford Gamble. Bradford Gamble is holding a cell phone to his ear with one hand, his other elbow resting on the arm of his wheelchair. On the wall behind him, besides a mantelpiece with an electric fireplace, is a series of decorative wreaths arranged like letters to spell out the word home. He is sitting in the living room of his nephew, Shaquan J. Jordan's West Philadelphia house, a place Bradford just started calling home. This cozy environment might as well be on a different planet compared to where he was a week before, 150 miles away, shackled to a hospital bed at Kissinger Medical Center. Despite the fact that Gamble uses a wheelchair, despite the fact that he has stage 4 metastatic cancer, despite the fact that he is dying, only 2 weeks ago, he was still a prisoner in the Pennsylvania Department of Corrections, and whose quote-unquote custody he had been for the last 46 years. In 2021, Gamble was taken to the medical wing of State Correctional Institution Cole Township, where he had been imprisoned, and told he was getting a routine colonoscopy. What he did not know was that the medical staff at the prison performed a biopsy and extracted a link of his intestines. Their test confirmed that he had colon cancer. For 8 months, no medical staff, no prison administrators, no one relayed this diagnosis back to the patient, whose worsening abdominal pain and other unexplained symptoms were being treated with 2 Tylenol a day. Finally, Gamble learned he had undergone a medical test without his knowledge or consent after a member of the medical staff casually inquired as to whether he got the results from his biopsy. He told this purported healthcare worker that he didn't know anything about any biopsy. Oh, came the reply. Well, it's probably cancer. After months of Gamble filing numerous grievances with the prison administration and petitioning prison medical staff with demands to see his own medical records, one day a guard walked past his cell and without breaking stride dropped a narrow piece of paper on the floor within reach. It was a medical slip with only a sentence or 2 printed on it, which confirmed the diagnosis of colorectal cancer, as well as the news that his prognosis was terminal as a result of metastasis. The cancer had spread to his lymph nodes. Gradual reform isn't compassionate. In Pennsylvania, in order for an incarcerated person to even be considered for quote-unquote compassionate release, they must be too sick to walk and have proof from a medical doctor that they are going to die in less than a year. The laws that determine whether a person can be freed from prison because of failing health vary from state to state, but a trend toward establishing procedures for this kind of quote-unquote compassionate release has emerged since the First Step Act was passed by Congress and signed by President Donald Trump in December 2018. Even so, over 20,000 elderly and dying prisoners sent petitions for compassionate release between January 2020 and June 2021. Only 3,608 were granted. During that same 18-month period, 2,715 prisoners died as a direct result of the COVID-19 pandemic, and an additional 400,000 prisoners contracted the virus and became seriously ill, including Bradford Gamble. There are over 300,000 prisoners in the U.S. over the age of 50. A 2018 report, The High Costs of Low Risk, the Crisis of America's Prison Population, it reads, quote, with an estimated 2.3 million people in confinement, 1 out of every 32 adults under correctional control or community supervision, and roughly 1/3 of all adults with some sort of criminal record, the U.S. surpasses all other countries in sheer numbers in per capita incarceration and criminalization rates. By 2030, the population of people aged 50 and older is projected to account for 1/3 of all incarcerated people in the U.S., amounting to a staggering 4,400% increase over a 50-year span. Gamble was only 20 years old when he was condemned to spend the rest of his life in prison. Now he's 66. No technology existed then that even resembled the mobile device he can now hold in his hand and hear the voice of Brian Arroyo, an organizer, environmental activist, and workers' work contributor. At 50 years old, Arroyo himself has spent more than half his life behind bars for a crime he didn't commit. But in addition to waging his own struggle for freedom and exoneration, Bryant fought a relentless battle to win quote-unquote compassionate release for Gamble, for whom he calls Bob. After months of phone calls, letters, emails, petitions, legal dead-ends, obstruction from prison officials, Gamble became one of only 17% of terminally ill prisoners in the country whose compassionate release petition was accepted. And speaking about Arroyo, Gamble says he was God sent. He tells the half a dozen people who crowded on the couch in front of him after his release. They're all abolitionist lawyers and activists assembled by Bryant and organized to advocate for Gamble's release, including the members of the Abolitionist Law Center, the Innocence Project, and the Prisoner Solidarity Committee of Workers Worldwide. I tell everybody that I talk to, family members, friends, when they ask me, how did you get out? I say, Brian Arroyo. Bradford Gamble says healthcare workers in the U.S. need to understand how much rampant neglect and abuse that their purported colleagues are committing in prison medical facilities. And he believes they have an obligation to intervene on behalf of prisoners who are suffering and dying as a result of this ill treatment. And we'll get to hear from Bradford Gamble himself, speaking directly to healthcare workers.
We need help. As simple as that. We need help. And you might say it's not your problem. But if you had a loved one, or if you do have a loved one, in the same position that I'm in, that I was in, and that people are in jail, you would think different. So think different now. Don't wait. Let us know that you love us, that you care about us. The words care in your job description should mean a lot. And I just wanted y'all to know that we're asking and we're not ashamed of saying we're begging for your help because we need it. I'm out here now, but I never left the prison because mentally, the people that I love, a lot of the people, some of the people that I love are still there, and they need your help. Please help us.
The horrors that Bradford Gamble faced while in prison are not an anomaly. And in fact, with the mass incarceration of 1.9 million people in the United States today, which evolved from chattel enslavement to convict leasing to mass incarceration, it is an ongoing genocide by another name. Confinement in prisons, jails, and detention centers disproportionately affects already vulnerable populations, including poor people, Black and Indigenous people of color, Black and Indigenous and people of color, LGBTQ plus people, people with disabilities, and those who find themselves at the intersections of more than one of these categories all at once. And if you're following along on the slides, you can click on anything that's underlined, and it will take you to data, relevant data. So each of these demographics, there's data from the Prison Policy Initiative if you're interested in learning more. I'm not going to linger too much on it for the purposes of today's presentation, but just know that those disproportionate numbers affecting those particular groups are pretty staggering, so check it out. Now we'll be hearing from one of our members from Boston, Maya X. She's going to be reading a poem that came out of a book in the aftermath of the Attica Rebellion.
The American Slave. Why am I still a slave in a land supposedly free? And when does it all end for a poor person such as me? I've been to their schools and I've been to college too, but trying to find a job, they say, we have nothing for you. Finally, I found a job working in a department store, and all I'm required to do is to sweep and mop the floor. I listen to the boss and try to be humble and meek. And for all the work I do, I get paid $80 a week. $40 a week must go towards my rent. And what it costs to eat these days won't leave me a cent. Now I'm not working, so where will my food come from? There must be a better way than singing "We Shall Overcome." Everything in America seems to point to an early grave. And no matter what is done, you still remain a slave.
Now we'll take a look at an overview of mass incarceration, a zoomed out view, if you will. If you're interested in looking at this chart or any more charts from this particular report, which is about mass incarceration in 2020. So how many people are locked up in the United States? The US locks up more people per capita than any other nation, with a staggering rate of 573 per 100,000 residents. But to end mass incarceration, we must first consider where and why 1.9 million people are confined nationwide. And if you want to view this chart or any of the charts that we're going to be looking at, you can check out the report in detail and visit Mass Incarceration, the Whole Pie, 2022 by the Prison Policy Initiative. You can follow the underlined link. If you notice, most of the people incarcerated are in state facilities, and conditions in different states vary, depending on where people are at. There's also a lot of people in federal prisons and jails. I want us to focus a bit on how many people are in local jails, which are usually run by county sheriffs. If you notice, out of the 547,000 people in local jails, 445,000 of them are not convicted. They have not been convicted of a crime. Many of them have had their trials pushed back and pushed back. They are simply sitting in horrible conditions simply because they cannot afford to pay bail. Also, if you notice, there's quite a number of youth that are locked up on a daily basis in the US, over 36,000. We've got about 32,000 people in immigration detention. Now I'm going to draw your attention to an international tribunal on human rights abuses against Black and Brown and Indigenous peoples that was held October 23rd to 25th in 2021 at the Malcolm X and Dr. Betty Shabazz Memorial and Education Center in Washington Heights, New York City, which is Lenape land. The main theme of the tribunal was "We charge genocide, we still charge genocide." In recognition of the "We charge genocide," the crime of the government against the Negro people, which was a 1951 petition to the United Nations signed by dozens of notables, including Dr. W.E.B. Du Bois, Claudia Jones, Harry Haywood, and Paul Robeson. The 2021 indictment is against the United States of America, represented by its president, State Department, federal and state policing agencies, and other governmental institutions. I'm going to give a brief background on the tribunal and touch on 2 or 3 relevant findings of the tribunal. And if you're interested in reading more in full, you can follow the links on the right of the slide. The panel of jurists at this tribunal heard testimony emphasizing the millions upon millions of Indigenous and African peoples murdered, disappeared, and nearly exterminated over a period from 1492 through the present. Further, the witnesses and prosecution argued that the wrongs have been historic and deliberate, with colonialization, racism, militarism, imperialism, materialism, criminalization, patriarchy, neocolonialism, and internal colonialism as part of the larger process that now manifests itself in medical and digital apartheid, chemical warfare, environmental violence and racism, disinvestment, and a pandemic of accessible guns and drugs, with the majority of gun violence perpetuated by police and security forces in the false claim of upholding law and order. Statements were made testifying to new forms of colonialism, which include the prison industrial complex, the military industrial complex, and the commercialization of our health and privatization, commodification of all social services. These testimonies included substantial evidence of the erasure of histories, distortion, and cultural misappropriation, which contributes to and exacerbates the attempted invisibilization and denial of people's basic humanity. The profound impacts of all these realities extend beyond the erasure and attempt to exterminate Black, Brown, and Indigenous lives. Hence, as one witness stated, the colonization of the spirit and mind continues to this day. The testimonies of this tribunal reaffirm the traditional wisdom and knowledge of Black, Brown, and Indigenous peoples. Strong evidence was presented on the indomitable, unbreakable resistance and resilience of the people's struggle for justice and dignity. In the face of barbaric human rights violations and crimes against humanity, this spirit of collective survival shone through. The 2021 International Tribunal on U.S. Human Rights Abuses against Black, Brown, and Indigenous Peoples was initiated by a U.S. coalition in the spirit of Mandela. Its own recognized legacy based on the efforts dating from the 1951 We Charge Genocide petition to the present rests on the idea that any examination of U.S. human rights must be done in an international context. The panel of jurists came together as an independent body made up of legal scholars, human rights advocates, and activists and community leaders. Utilizing the international criminal law on genocide and other instruments, the panel convened to hear and review the testimony organized by the Spirit of Mandela legal team. I'm going to touch on a couple of summarized preliminary presentations of testimony. It lasted for 2 days, but I will briefly speak on mass incarceration to start. Testimony emphasized that in the case of U.S. constitutional law, while the 13th Amendment promised the abolition of the process of chattel slavery, it in fact created an exception incentivizing the incarceration of people of African descent and other peoples. Further, they argued that a school-to-prison pipeline has been set in motion by the racialized policies and programs of the U.S. federal and state governments. One testimonial noted, quote, "The law is used as a weapon of war," end quote, against Black, Brown, and Indigenous peoples. Further testimony indicates that there are U.S. policies of wars on poverty, wars on drugs, wars on terror, and others, amounting to a war on Black, Brown, and Indigenous peoples. As far as environmental racism is concerned, testimony was received arguing the impact of environmental violence. They asserted that the climate crisis disproportionately impacts Black, Brown, and Indigenous peoples, constituting environmental violence. The prosecution contended that there is a deliberate and callous poisoning of land, water, air, and soil, reflecting the valuing of profits over peoples, which threatens the survival of the planet and impacts most devastatingly the lives of Black, Brown, and Indigenous peoples. And finally, the last thing I will touch on from this international tribunal is public health inequities. The testimony highlighted deep public health inequities, including both physical and mental health manifestations. Further assertions were made that the COVID-19 pandemic and an inadequate and incompetent federal response to the crisis, magnified the disparate impact of structural racism affecting access to healthcare. Moreover, testimony was heard regarding indifference to the suffering of groups of people considered expendable due to the profit model of U.S. healthcare, leaving behind the most vulnerable. The prosecution argued that from forced sterilization to food deserts and chemical contamination, from toxic stress based on the environment in which one lives, to the criminalization of mental illness, Black, Brown, and Indigenous people are neglected and left out of any illusion of the human right to health. While these crimes are well documented, they have more rarely been acknowledged, remedied, and addressed, with some very distant from public knowledge. Despite the need for further deliberation on the extensive submissions and documents from varied expert witnesses, a deep analysis from the jurists of the tribunal found that the process did sufficiently cover the scope and elements of all 5 counts in the indictment as having legal standing. After having heard the testimony of numerous victims of police racism, mass incarceration, environmental racism, public health inequities, and of political prisoners and prisoners of war, together with the expert testimonies and graphic presentations, as well as copious documentation submitted and admitted in the record, the panel of jurists found that the U.S. and its subdivisions are guilty on all 5 counts. They found grounds that acts of genocide had been committed, and the verdict was signed October 25th by the panel of jurists. And if you're interested in learning more about that tribunal and those jurors, again, you can follow on the side of the screen. People incarcerated in prisons, jails, and detention centers face unique challenges to maintaining basic human health. The right to health care often clashes with the overriding concern in any jail or prison or detention center, which is security. This focus unfortunately means that security staff, not medical providers, are often the first ones to make decisions about whether the person can leave their cell or housing to seek medical attention. For instance, at Rikers Island, each of the 8 jail buildings has its own medical clinic. But that doesn't mean if a person feels sick or needs care, they can readily access it. First, the sick person must tell the officer on the housing unit. Then it's up to the officer to submit that person's healthcare request to medical staff. But according to jail medical staff, they don't always do so. In 2013, jail officials at Rikers further impeded access to healthcare when they stopped allowing incarcerated patients to walk to clinics alone. Instead, a guard was required to escort people to the clinic. The result of this? People missed their appointments nearly half the time. This wasn't because of animosity from the jail officers, but simply because it was too much hassle to escort every individual to the clinic. In response, medical providers gave jail staff lists of must-see patients whom they feared might die without receiving care. But these improvements were often short-lived, ending when a sympathetic official was promoted, transferred, or fired. At that point, noted Homer Venters, the former chief medical officer for the city's jails, quote, "We would fall back to half or fewer of our patients being produced for medical visits while in custody. Jails and prisons are not equipped to provide special medical care. If such care is needed, medical staff may recommend that the patient be taken to an outside clinic or hospital. If that recommendation is approved, and it is often not, 2 officers must escort the patient at all times. The person is not only handcuffed, but fully shackled, meaning their handcuffs are tethered to a chain around their waist. They are also cuffed in leg irons, which are tethered to their waist by another chain. That's why an imprisoned person named Kamadia doesn't seek off-site medical care. Before she can get on the bus to go to an outside medical provider, she is strip searched, handcuffed, shackled at her waist and feet, and brought to the prison's back gate, where she is strip searched again. Quote, she says, "You remain in restraints throughout the trip, even if the trip lasts 6 to 7 hours. End quote. Because Kamadia is in solitary confinement, she's separated from others on the bus. The toilet is about a foot away from her, quote, usually overflowing. The smell is putrid, end quote. If she needs to use the bathroom, she must struggle with the full restraints on, not only to lift the toilet seat, but also to remove her pants and undergarments. Those not in solitary can enlist another person to help them remove their pants and undergarments and stand in front of them to ensure a modicum of privacy. In addition, the bus has no toilet paper. Quote, many girls don't eat or drink, so they don't have to use the restroom, end quote, said Kamadia, who is now in her late 40s. She hasn't sought medical care for 3 years. There's also a financial hurdle to medical care. 42 states, as well as the federal prison system, require a copay from incarcerated patients. These copays range from $3 to $5, though some can be as high as $7.50 per visit. This may seem like peanuts, especially compared to the copays required for people outside of prison, but incarcerated people earn only pennies an hour at their prison jobs, if any at all. Given that there are not enough positions for the hundreds, if not thousands of people incarcerated in each state, many do not have prison jobs at all. Thus, even these few dollars can place healthcare out of reach for those in prison. In addition, some states such as Alabama, Arkansas, Florida, Georgia, Mississippi, South Carolina, and Texas do not pay incarcerated people. They pay them nothing for their work, but still charge them copays for medical care. In 2014, Texas legislators changed the state's prison copay system to a flat yearly fee of $100. But in prison, people can avoid that extravagant price tag by foregoing medical care. And it seems that they do forego that medical care. In 2014, 3 years after the copay system changed, only 15,000 out of the nearly 150,000 incarcerated Texans were able and did pay the $100 healthcare fee. Nearly half of the state prison systems and many local jails contract with private for-profit corporations to provide medical care. This means a private company receives a contract for a certain sum of money to provide health care to incarcerated patients. To ensure the maximum amount of these corporations shave expenses by hiring fewer and often less qualified and less paid staff members, requiring long and arduous processes for expensive medical care and withholding treatment altogether. Michigan's prisons, for instance, have a 5-year, $715.7 million contract with the private company Horizon to provide medical and mental health care to people in custody. More than half of its prisoners, 51.6%, are at least on one medication. But in the 2.5 years since Michigan hired Horizon, the state has withheld $1.6 million in payments to the corporation for violating their contract regarding the timeliness of care in routine and chronic care appointments. Prison healthcare systems, whether privatized or state-run, have a hard time attracting and retaining qualified healthcare professionals. But private healthcare providers often pay medical and mental health professionals less than state prisons, and they don't offer the same benefits. For example, Horizon's hourly pay for a registered nurse is $30 an hour, or that's $62,000 per year. In contrast, the average hourly pay for a registered nurse working for the California Department of Corrections and Rehabilitation is $51 an hour, or that's $107,000 per year. Healthcare makes up 16% of the budget of the Michigan Department of Corrections, but in February 2019, Michigan's prison system still had 86 vacant nurse positions and 44 vacant licensed practical nurse positions. With so many job vacancies across a system of 38,678 incarcerated people, Horizon cannot provide round-the-clock nursing or medical care. The quality of Horizon's care for incarcerated patients has repeatedly come under fire. In New York City, Horizon held the contract to provide jail medical care until 2015. The company has been sued by over 24 New Yorkers, including the family of Carlos Mercado, over the course of 2 years. The negative publicity, lawsuits, and hefty settlements have not deterred local jails and state prisons from using private healthcare corporations. As of February 2019, Horizon had contracts to provide healthcare to 301 jails and prisons in 22 states. One of its main competitors, Wexford, boasts that it provides healthcare for 120 correctional institutions in 13 states. Another competitor, WellPath, which is formerly Correct Care Solutions, boasts contracts in 550 jails, prisons, and behavioral health facilities across the United States and Australia. We're all gathered here because we know healthcare is a human right. And while the United States has not historically guaranteed human rights to everybody, it is incumbent upon us to humanize those who face inhumane conditions on a daily basis, particularly people who are incarcerated. I'm thrilled to be here. The Prisoner Solidarity is thrilled to be here today because healthcare workers are uniquely positioned to end some of the inhumane treatment faced by those incarcerated. I want to talk a little bit about some of the ways that healthcare workers have intervened with human rights abuses as it pertains to the prison industrial complex in the past, by giving an example and talking about the death penalty in the United States. I'm coming to you from the state of Texas, which is the killing capital of the country. Texas has executed 573 people since the 1980s, which is more than the next 6 states combined. in the modern era. And first and foremost, we oppose the death penalty because it is racist, it is anti-poor, and it is ableist. It evolved from the rope to the chair to the needle. It is a vestige of social control stemming from enslavement in the US. And the reason I bring this up is because execution drugs and executions in general are on the decline in the United States for the first time in history. And that is due in great part to mass international pressure from activists and community on pharmacists, asking them to stop executions. It worked in making drugs harder to get. Activists from around the world pressured pharmaceutical companies and pharmacists by calling on them to follow their code of ethics in doing no harm. And with a lot of pressure, those companies and pharmacists stopped making execution drugs for states. And I'll give an example of the effectiveness of that when it pertains to Arizona and South Carolina. Arizona announced in June that it had, quote unquote, refurbished, end quote, its gas chamber and would seek to carry out executions using cyanide gas, which is the same gas used by the Nazis to murder more than 1 million men, women, and children during the Holocaust. The announcement drew international backlash and condemnation. South Carolina attempted to resume executions after a 10-year hiatus, scheduling one execution for February and another for May, even though the state had no drugs to carry them out. The South Carolina Supreme Court vacated the execution notices and ordered the state not to issue another death warrant until one of these scenarios took place. The state confirms to the court that Department of Corrections has the ability to carry out a lethal injection execution. A death row prisoner elects to be electrocuted instead, or the law changes to otherwise allow executions to take place. In response, the South Carolina legislature passed a bill in May 2021 making electrocution the default method of execution, with lethal injection or firing squad available as alternatives. The state immediately set 2 execution dates for June 2021 without having offered to the men set for execution an opportunity to elect their methods of execution. The South Carolina Supreme Court once again halted those executions, saying that the state had violated the prisoner's statutory right to elect the manner of their execution. The court also noted that the state had not yet developed a protocol for executions by firing squad and barred the state from setting any execution dates until a protocol is developed. So the death penalty is on its way out, and these examples from South Carolina and Arizona demonstrate how, desperate states are to continue on because they're not going to be able to do for much longer. Last year, Virginia was the first former Confederate state to abolish the death penalty. If we're talking about the number of executions in the modern era, Virginia comes in right after the state of Texas. Texas has executed 573 people since the resumption of executions in the 80s in Texas. And Virginia has executed, by contrast, 113. So Texas leads, but Virginia abolished the death penalty. And again, the pressure that healthcare workers and the role that they had to play in making these drugs harder to get for the majority of states really helped change the tide and the possibility of these legal lynchings or these executions. And before we carry on, I just want to mention 2 upcoming executions that are happening here in Texas. This month of April, Carl Buntian is being executed by the state of Texas on April 21st. He is elderly, he cannot even walk, and the state is trying to execute him. And Melissa Lucio, she is the only Latina on death row, the first Hispanic woman to be sentenced to death here in Texas. She has an execution date scheduled for April 27th. She is accused of killing her daughter, who fell down a flight of stairs. And after experiencing a lot of abuse in her life, gendered violence, Melissa Lucio was interrogated by the Texas Rangers for 7 hours and forced into a confession of killing her daughter, which she did not do. She's being executed this month. I bring that up just so y'all are aware. Now we'll be moving into what healthcare workers can do in the present, and we'll be starting off by hearing from some of the healthcare workers that are a part of the Prisoner Solidarity Committee, starting with Marie.
My name is Marie Kelly. I'm a member of the Prisoner Solidarity Committee of Workers' World Party and a registered nurse for over 40 years here in Philadelphia, Pennsylvania. The United Nations Human Rights Council issued a strong statement last year against shackling of incarcerated persons who are sick and/or hospitalized. This was in response to the shackling of political prisoner Mumia Abu-Jamal while he was hospitalized with heart failure and a COVID infection. The statement reads in part that, quote, "The use of shackles during his hospital stays is deplorable and causes Mr. Abu-Jamal additional and unnecessary suffering," end quote. Citing international standards on the treatment of prisoners, the UN human rights experts added that, quote, "Instruments of restraint are to be imposed only when no lesser form of control would be effective to address the risks posed by unrestricted movement. We are concerned that the medical condition of Mr. Abu-Jamal, who also suffers from a severe skin condition and hepatitis C, could be linked to years of medical neglect by the Department of Corrections of the state of Pennsylvania," end quote. The prison rights movement has made little progress since the Attica State Prison Rebellion of 1971, when imprisoned organizers penned the powerful statement given here by L.D. Barkley.
"We are men. We are not beasts, and we do not intend to be driven or beaten as such. The entire prison populace has set forth to change forever the ruthless brutalization and disregard for the lives of the prisoners here and throughout the United States. What has happened here but the sound before the fury of those who are oppressed."
Healthcare workers who are members of the Prisoners Solidarity Committee of Workers' World Party investigated the use of shackles of prisoners while hospitalized and concluded this inhumane practice is widespread in hospitals across the United States. The PSC of WWP is calling on healthcare workers to support a ban on this practice as it flies in the face of ethical patient care.
My name is Phebe Eckfeldt. I'm a licensed practical nurse, and I am a member of the Women and Gender Oppressed Caucus of Workers' World Party. Number one, ban the practice of shackling the incarcerated when hospitalized. Shackling of chronically ill and elderly incarcerated people has many negative impacts, including difficulty by healthcare workers to properly assess and treat a patient's condition, risks of falls and deep vein venous thrombosis, damage to skin integrity, and increased pain from poor mobility and positioning. Escape is not a legitimate concern. An incarcerated person must be very sick before the prison administration will allow them to go to an outside hospital. On top of that, standard protocol has an armed guard stationed with an incarcerated person 24 hours a day. United Nations human rights experts issued a statement April 20th of 2021 saying, quote, "International standards on the treatment of prisoners clearly stipulate that instruments of restraint are to be imposed only when no lesser form of control would be effective to address the risk posed by unrestricted movement," end quote. Demand 2, healthcare professionals must advocate for the release of incarcerated persons who are ill or aged. Carceral institutions are not equipped to provide timely, proper treatment for either acute or chronic medical conditions. Prisons and jails have not protected the incarcerated during the COVID pandemic, resulting in death by incarceration. Many have comorbidities that put them at great risk of succumbing to infectious outbreaks, such as influenza or coronavirus. The aged incarcerated population must be guaranteed Medicare and the quality of care it could provide. From forced sterilization to food deserts and chemical contamination, from toxic stress based on the environment in which one lives to the criminalization of mental illness, Black, Brown, and Indigenous people are neglected and left out of any illusion of the human right to health. This quote is from the Spirit of Mandela Tribunal, 2021. Healthcare is a human right.
Maya X, revolutionary student, member of Workers' World Party. Point 3, restraints should never be used for staff convenience or client punishment. The Joint Commission on Accreditation of Healthcare Organizations, JACO, regulations for not using physical restraints must apply to incarcerated persons who are admitted to a hospital. The healthcare team is responsible for practicing situational awareness, evaluating, and initiating other therapeutic measures to adequately provide treatment before resorting to using restraints. A complete doctor's order is needed to initiate the use of restraints. Restraints without a valid and complete order are considered false imprisonment, and hospitals are liable for any injury to patients caused by restraints and jeopardize the hospital's accreditation status. Number 4, incarcerated pregnant persons will have their privacy safeguarded at all times and will remain unshackled during labor, childbirth, and postpartum recovery. The United Nations, Amnesty International, and other prisoner advocacy groups condemn the practice of shackling during childbirth. Kimberly Mays, who was shackled during childbirth in 2000, likened it to giving birth in front of human masters, in quotes. The American Nurses Association and American College of Obstetricians and Gynecologists are against the practice, citing the risk of harm to both the mother and fetus. The American Psychological Association takes a stand against the practice because of the emotional trauma it causes, especially since many incarcerated women have been the victim of sexual or physical abuse. After delivery, shackles interfere with the bonding process between mother and child, since the mother has a hard time safely handling her baby and breastfeeding. In 2018, the First Step Act became a federal law, banning shackling of imprisoned individuals during childbirth, labor in federal prisons. As of 2020, 27 states ban shackling of pregnant prisoners. In practice, these laws are frequently ignored and not enforced. The shackling of patients during childbirth should be banned unconditionally at all levels of the carceral system. Anything less than a total ban will allow this dehumanizing practice to continue.
Number 5, healthcare institutions must have the incarcerated patient verify the family or loved ones they designate as eligible to receive updates on their medical condition and treatment. Hospitals must establish a protocol to make every effort to ask the patient who is eligible under the Health Insurance and Portability and Accountability Act, HIPAA privacy rule, to be notified of the patient's condition and treatment and display this person or persons' contact information prominently in the patient's record. A member of the patient's care team should communicate regularly on the patient's condition and treatment with the individual or individuals who the patient designated. Number 6, hospitals will adopt policies and staff educational programs on caring for incarcerated admitted patients. The focus of such programs should be on compassionate, not punitive care, and follow ethical standards of practice outlined by the American Medical Association in their Code of Ethics. Quote, all individuals have a fundamental right to be free from unreasonable bodily restraint. Except in emergencies, patients should be restrained only on a physician's explicit order. Patients should never be restrained punitively for convenience or as an alternative to reasonable staffing. Physicians who order chemical or physical restraint should, 1, use best professional judgment to determine whether restraint is clinically indicated for the individual patient, and 2, obtain the patient's informed consent to the use of restraints. And in the American Nurses Association Code of Ethics, specifically Provision 1, the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. Provision 3, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. And Provision 4, the nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes action consistent with the obligation to provide optimal patient care. Number 7, healthcare professionals should support prison abolition efforts. The carceral system is physically, emotionally, and psychologically inhumane. Solitary confinement, overcrowded living conditions, inadequate nutrition and healthcare, meager wages for work, a judicial system which is disproportionately incarcerating people of color are all factors in the disintegration of families and communities. The only credible solution to this public health and humanitarian catastrophe is prison abolition. Hear, hear.
Loud and clear are the echoes of chattel slavery in the Americas that developed handcuffs, shackles, and fetters to control the enslaved population. Dr. Joanna Fernandez. And if you're not sold on prison abolition, that's okay. I have included some resources in this slide, and you're welcome to speak with us further. And with that, I'm gonna reiterate, that healthcare workers are so uniquely positioned to end some of this inhumane treatment faced by those incarcerated. Nurses and other clinicians, they can demand that shackles be removed, using the chain of command within an institution to develop and implement or uphold existing policies that advocate for safety and dignity is paramount. If a policy is unclear, using the Ethics Review Board is another option. Nurses and other clinicians can also educate correctional officers on best practices for the healthcare of the incarcerated. They can and must notify hospital and nursing administration if policies have not been upheld or if they are unclear. Nurses are in a pivotal position to advocate for incarcerated people, whether they work in hospitals, community agencies, obstetric practices, correctional facilities, or state governments. And it can help to look at what laws are in your state. I've included here a slide showing the different states with anti-shackling legislation as it relates to pregnant people incarcerated, and it links to a medical journal, and which you can read a little bit more about that. If you need help with any sort of research in your area, we'd be happy to help. We've included in our helpful links this flyer that you're welcome to use for educational purposes. These are the pieces that our wonderful PSC members have just read out loud. And if you have any questions about any of this, whether it's prison abolition or how to adapt what we've talked about to your particular healthcare circumstances, no matter what kind of job you're working, we'd be happy to work with you. And you're welcome to contact us by emailing prisonersolidarity@workers.org. You can follow us on social media platforms like Twitter, Instagram, Facebook @PSCWWP. And you're welcome to support our efforts financially via Venmo @WorkersWorld. And you can be sure to put Prisoner Solidarity Committee in the memo line. I've also included further suggested relevant readings and media if you're interested in learning more. And thank you so much for your attention and for your efforts to make sure that we have health care for everybody. Thank you.